Hello, 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 Facebook. I am Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I am coming on tonight to talk about the different types of fat on your abdomen and your options for getting rid of those things, getting rid of those different types of fat. So I've been getting questions here and there. Hi, Irina. Hi, Tommy. Hi, Rachel. Hi, Kimora. I guess I should wait a second and let people log on before I go and start talking. Hi, Danielle. So I did it early tonight because I know the game comes on. So I think last week I made a mistake and went live when the game was on. And I should know when the game is on, considering Cleveland is in the finals and I'm from Cleveland, but I had no clue. So since I knew tonight, I decided that I would go on a little early so that people can watch the game in peace and I have to listen to my big mouth while the game's on. Let's see who's on. Hi, Rachel. Hi, Courtney. Hi, Shamika. Hey, Gigi. Hi, Melanie, Terry. Irina, is called visceral fat. Visceral. Visceral fat. I'm going to talk about that. So, for you guys that are on, please go ahead and share the video and let people know I'm on. Let people know I'm talking about this because this is actually something that people who haven't even gotten plastic surgery ask about. And sometimes people will come into the office wanting certain types of procedures done because their belly is big. And I'm like, yeah, you can't get that. So this is one of those topics that a lot of folks need to hear about. So go ahead and share the video and spread the word. So, nope, Tommy, you got it the other way around. Pinchable fat is not visceral fat. Visceral fat you can't pinch. It's behind your muscles. So let's get started. We can go ahead and start talking. So, this is going to be one of those situations where I draw pictures. Let's see. Let me just go ahead and draw the first picture now, so I can show you guys the fat layers. And excuse me, my kids are upstairs. I made them go upstairs so that I could do my video in peace, and they are loud as heck up there. Okay. I should have turned this other light on so it'll be a little bit brighter. Okay, I'm going to flip this camera around for a second so I can show you guys this picture. All right. So imagine that you're like laying down on the table and I take like a guillotine and cut your body so that you can see the layers in there, okay? So this is your skin. This is extra abdominal fat. So this is the fat you can pinch. This is your muscle layer. This is the rectus muscles, the space between it. That's what people usually have, a diastasis. That's the gap between the two muscles. You shouldn't have a gap. They should be kissing, okay? And then behind the muscles, this is a muscle layer, okay? And then behind the muscles, you have some organs. I'm just drawing. These little circles represent organs, okay? And then around the organs is visceral fat. This is visceral fat in here. Sorry, not in the organs. Well, sometimes it's in the organs, but it's around the organs, okay? So when you get pinchable fat, is this fat that's on top of the muscles. You see, I can't pinch this. It's protected behind your ribs, behind your muscles, like it's inside of your body where you can't get to it. This right here, you can take your hand and squeeze it, and that's pinchable fat. That's called extra abdominal fat, meaning outside of the abdomen. This area here is technically considered your abdominal cavity. So extra abdominal, you got intra-abdominal fat, also known as visceral fat, muscle layer, extra abdominal fat, and then you have skin. So when you get liposuction, this is the area that is addressed. The liposuction cannula goes in this plane and makes this fat layer smaller. The liposuction cannula does not go in here. So if you are just obese, like grossly overweight, and your belly is sticking out, that's like your potbelly uncle. You can't pinch his fat. So your potbelly uncle would have a thin layer here, but he would have a whole lot of fat in this part, and that's what makes his belly stick out. And if you can't pinch it, that means it's behind the muscle. That means we can't get to it surgically. The only surgery that will make this fat get better is weight loss surgeries like gastric bypass, gastric band, gastric sleeve, those types of things. They make you lose weight overall, and it'll make this fat burden go down. It'll decrease this fat burden. And this one, actually. Those weight loss surgeries make fat go away diffusely. But you can't get liposuction and address this fat here. Because if you have a liposuction cannula running around in this area, you'll perforate organs, and that will cause you to die. No good. So that's the difference between the different types of fat. Extra abdominal fat, intra-abdominal fat, or visceral fat. Those are the two types. So when people come into the office for consultation, I'm going to turn the camera around. No, I don't do bypass surgery, Sharon. I'm a plastic surgeon, so you want to go to a bariatric surgeon for those types of surgeries. So once people lose weight from the bariatric surgery, that's when they come to me. Okay. So the other way to lose visceral fat is with diet and exercise, obviously. That's the ideal way to do it. It has the least amount of risk as long as you're doing it in a healthy way, and it'll make fat go away from your whole body. So that'll affect intra-abdominal fat and extra-abdominal fat. If you don't, liposuction is designed for, liposuction is best used when a person's body is a good size overall and they have trouble areas. That's the best way for a layperson to tell the difference, Marie, is pinching. If you can't pinch it, then it's probably visceral fat. It is visceral fat if you can't pinch it and your belly is big. If you can't pinch it and you're thin, then it's not any kind of fat. It's just you're thin. But if you have a lot of girth and you can't pinch it, you either have visceral fat or you have something called ascites, which is a whole nother thing. Ascites is a bunch of fluid in your abdominal cavity that is caused by liver failure. So sometimes the beer belly uncle, that's part of why they call it a beer belly, is because oftentimes people have liver damage from drinking a lot, and when the liver gets damaged, it causes a bunch of fluid to back up inside of your abdominal cavity and make your belly stick out. And that's not pinchable either, because it's not even fat, it's fluid. So your options for getting rid of visceral fat is diet and exercise. And if it was something surgical that would be considered an option, it would be bariatric surgery in the form of gastric bypass, gastric band, gastric sleeve, any of those gastric surgeries for weight loss. Then for extra abdominal fat, you have the option of diet and exercise. That's always first line. Then as far as surgical options, you have liposuction and tummy tuck, sort of. Now, with the tummy tuck, I'll draw another picture. It only addresses the extra abdominal fat below your belly button. Okay, flip this camera around again. So if you have say you have like hanging, like a hanging droopy belly with some fat in there, a tummy tuck would take away this hanging stuff. So all of this would be cut out. So the fat that is also in this area goes away. And then this skin edge, so basically this part of your abdomen, this skin edge is pulled down to here, and then we make a new hole for the belly button. But the thickness of this part right here remains the same. So you pull it down to here, but you still have fat in there. So a tummy tuck doesn't address any of the fat above the belly button. It just addresses the skin and the fat on your lower abdomen. So people will often ask me, I had a tummy tuck and I still have fullness at the top. It still seems big at the top. What can I do? That's because a tummy tuck is not going to make that top go down if you're overweight. So then that means later you have to go back when it's a safe, an appropriate time, go back and do liposuction of that top of your abdomen to get it all the way flat so that the liposuction can get rid of the extra abdominal fat that was above your belly button. So that's how you get rid of that. The other options for getting rid of extra abdominal fat is with some non-invasive things like cool sculpting or sculpture. Those types of non-surgical fat reduction treatments will reduce the fat load, actually kills fat cells, and makes you smaller. It doesn't do anything for visceral fat. It only does it for the extra abdominal fat. And that only works if you don't have too much of it. So if you have a whole lot, if your fat layer is this thick, getting some cool sculpting is not going to make a big difference. That's a situation where you either want to lose weight or maybe get liposuction. What's the difference between the two what? The difference between the two what? Cool sculpting and sculpture. Cool sculpting is fat freezing. And sculpture uses a laser. Sculpture uses a laser to heat and do cycles of heating and cooling of the tissue, and it causes fat cell death. So that's a good non-surgical option if you just have like a small trouble area. If you have like an entire your entire trunk like all the way around that you want to make smaller, it could get so costly that it doesn't even make sense to do that, and it will just be easier and make more sense to do liposuction if you have a lot of area that needs to be shrunk down. Ooh, Tommy, the dresses you got her, I think we'll probably go ahead and try them on now. She's gotten a little bit bigger. She might be almost ready to fit those dresses. I cannot wait until she can fit those dresses. Those were the most beautiful dresses. Tommy got my baby some beautiful dresses for when she was born, and I can't wait till she can fit them. So they were so classy. I will definitely be putting pictures up of her when she puts those dresses on because they're fabulous. Okay, let me see what questions I missed because I'm sure I missed a lot. Hey, Sharon. If I don't lose visceral fat, will I not be as flat after a tummy tuck? My BMI is 25.4. If your BMI is 25, you'll be fine. If you have loose skin, depending on how loose it is, you probably will need a tummy tuck. You're welcome, Deirdre. I had a tummy tuck and muscle repair, but have a little bulge sticking out. Can it be the inside fat? It could be that. It could be a suture popped. I don't know where the bulge is. If it's in the midline and it's just one little discrete spot, that could be an indicator that a suture popped in your muscle repair. Which is a better option, mini tummy tuck or liposuction? That the two don't compare. Like I would make the more logical question would be which is better, a mini tummy tuck or a full tummy tuck? A liposuction doesn't address the same thing as a tummy tuck. I guess it depends on where you have fat that you're trying to get rid of. I can't say that. It's not necessarily that one is better than the other, although I really personally don't like mini tummy tucks. But putting my personal feelings about mini tummy tucks aside, it depends on what you have going on that will say which one is better. Because both of them are bad if it's the wrong operation. Love handles is extra abdominal fat. Extra, EXTRA, abdominal, like meaning outside of the abdomen. Oh, it's echoing, Tommy. My bad. I'm sorry. Which should you do first, tummy tuck or lipo? Sometimes I do tummy tuck first. Sometimes I do lipo first. It really doesn't matter. It depends. Kind of how I make a decision is based on which operation has the highest likelihood of making the person happy with just one operation alone. And that's usually what I will do first. Sometimes if I know for sure a person's going to need a tummy tuck, maybe I'll do the tummy tuck first. And then they can come back and get the abdomen liposuctioned if they feel like it's, sorry y'all know I got a newborn, I'm always yawning. If they feel like it's not quite flat enough. But it really doesn't matter which one you do first. The baby is doing great, Ashley. She's getting bigger and bigger every day. Oh, your insurance won't pay for it. You're welcome, Terry. I have my patients wait at least 3 months between tummy tuck and liposuction when we stage it. You're welcome, Sarita. Yes, you can get cool sculpting on the arms. You said you saw a video of someone in my office getting fat removed while they were awake. What procedure was that? That was liposuction. I just did that today and I'm doing 2 tomorrow. I do that more than anything is liposuction. I need the top of my belly. I hate it. How do I get rid of that? Probably liposuction, but I haven't seen your belly, so. It depends, Shamika, it depends on when they do the revision in relation to when the first surgery was. Oh, Tommy, you said it's not letting you hit the heart button on there? Well, that sucks. Question on surgical drain. If the bulb is compressed only halfway, is it still doing what it needs to do? Yes. But that sounds like you have had surgery and you should be asking your surgeon that question. So I am not a post-op visit. And I don't like when people, I'm just going to put this out there. I don't like when people have surgery with somebody and then come on my lives and try to turn me into their post-op appointment. Talk to the person who you paid to take care of you about if your drain is working right. That's not my place to tell you about that. Talk to the person that you trusted with your surgery and your body about how to take care of it afterwards. The stomach, that's a good question, Christina. If you have that stomach hang from a C-section, will anything else work besides a tummy tuck? Yes. So it depends on how much you have. But I got a little bit of that stomach hang after my C-section, and I'm really annoyed. It's so little. It's like small and annoying, and I hate it. And I just haven't done it yet because I've been so busy. But I'm going to do, because mine doesn't have a lot of fat in it. It's just like skin hanging a little bit right over the C-section scar. And so what I'm going to do when I get 5 seconds to lay down in my esthetician's table is get radio frequency skin tightening to tighten that skin back up. If it's fat too, then you probably need to get it cut. But there are even still some modalities for non-surgical fat reduction that can make the fat go away and tighten the skin at the same time. Excessive skin requires an upper or lower body lift. Do you do that type of procedure? Yes, but a body lift is when you get it all the way around, like your belly, sides, and back get lifted at the same time. So you literally have a cut all the way around. So I don't know if you need that or not, because I haven't seen you, but I've done those. Tiffany, can I send you some pics of me if possible to show you what I'm dealing with? You can send them, but I'm not going to tell you my opinion without you paying for a consultation. So they're going to just be sitting there. So if you would like my professional opinion about what you have going on with your body, I would love to consult with you. You can reach out via my website, and I'll put it in there. And my staff will contact you to get you set up for a consultation. And if you don't live in Atlanta, we can do virtual consultations as well. Or you can call my office and my staff can get you set up for a consultation. There's my website. And I hope to talk to you soon, Miss Tiffany. Laverdin, if you have loose skin, it depends on how much. So cool sculpting is definitely not if skin is your major issue, cool sculpting is not what you would be going to seek out. However, if a person has a little bit of loose skin, but there's a lot of fat in there too, and you get cool sculpting, when the fat dies and stuff starts to contract, sometimes the skin will go down too. So once again, it just kind of depends what you have going on. The problem is that you all should not be trying to diagnose yourself to figure out what you need. That's why you need your board-certified plastic surgeon to examine you, and based on what your goals are, can help you come up with the right thing. A mini tummy tuck is really just cutting the excess skin away from the bottom and closing it. Like, there's no muscle repair, there's no movement of the belly button, none of that kind of stuff. So if you just have a flap of skin at the bottom of your belly and you don't have an issue with muscle damage and you don't have a bunch of fat on your abdomen, then a mini tummy tuck is the option. I've lost 110 pounds since January 2017, but I don't have loose skin. I have fat above and below my belly button. What kind of procedure would possibly help me? If you don't have a diastasis, probably liposuction. And congratulations on your weight loss. Aw, thanks, Tommy. Right. If you have no fat and just loose skin, lipo is a waste of money. And so the person should tell you no. Unfortunately, everybody's not ethical. But if you don't have fat, you shouldn't be getting liposuction. 58 is not too old to do liposuction. I did liposuction on my mommy when she was 60. Was that like 2 years ago? 64. Lipo 360 and gluteal contouring on my mother. Yeah, as long as you're healthy. It's really not your age necessarily. I mean, obviously I probably wouldn't be doing lipo on a 90-year-old, but as long as you're healthy, that's not too old. I don't quote over Facebook. The only way to get a quote from me about price is through a consultation. But I will say that my liposuction starts at $4,000. But that's just like if you're getting one area. Your interesting word choice, just lipo. So people always say that, oh, I just want a little lipo. And so they think that the price is little, should be little because lipo seems little because you have little incisions. But lipo is a very rigorous surgery and a lot of work and very physically taxing on the surgeon. And so it's not a little lipo, almost never. And it's a lot of work, so it's not cheap. Because people just assume lipo is cheap, and it's not. It's so much work. I break a sweat, literally sweat, when I do liposuction. And I don't break a sweat when I do a tummy tuck. But liposuction is a lot of work. Yes, I do virtual consultations. It's still called, Kim Rivers, we said, what's the name of the procedure when you stay awake while removing fat? That's still called liposuction. Whether you're awake or not doesn't change the name of the surgery. It's liposuction. Do I ever do both what at the same time? Tummy tuck and liposuction? If you're talking about tummy tuck and liposuction, I don't ever do those two at the same time. Unless I'm doing liposuction of like the person's flanks, like the sides, or I can lipo your back. But I won't liposuction your central abdomen at the same time as the tummy tuck. And some surgeons do it, but then you guys have heard about that necrosis thing. Every time I'm in those groups and somebody posts pictures of their necrosis or something, and I'm like, did you have liposuction and tummy tuck at the same time? The answer is always yes. You don't get dead skin and fat of your abdomen without doing both at the same time. The only time I've seen like maybe the wound kind of break down in the center on a tummy tuck is when it's like a fleur-de-lis abdominoplasty, which is the one where you have 2 incisions, one up and down and one across, and sometimes you'll get some breakdown where the 2 incisions meet. But with a tummy tuck alone or liposuction alone, when it's not, that's my baby girl. She's with her Auntie Mia. You want to say hi to Facebook, Auntie Mia? Oh, she said no. I've actually seen people have necrosis of their abdomen without having a tummy tuck when they've gotten aggressive liposuction. So if you overdo it with the liposuction and knock out too much of the blood supply, then the skin and fat are going to die over that area. And then people will be like, I got lipo burns, I got burns from my garment. It's not from the garment, it's from too much blood supply being compromised because people trying to get aggressive liposuction. So I don't ever do both liposuction of the central abdomen and tummy tuck at the same time because I think the risk is too great. When it works, it's awesome, but the problem is that too often it doesn't work, and the ladies are disfigured permanently. What's the cost of what? It's the same thing for liposuction with the BBL thing, and it just depends on if they took fat from your abdomen or not. But each doctor probably has their own recommendations for time, but for my patients, I put 3 months between the two. What insurance are covering the procedure? Covering what procedure, Ms. Bad Angel Wiley? Insurance doesn't, I don't take insurance, so it won't cover any procedure in my office. I don't accept insurance. Insurance doesn't cover tummy tucks or liposuction. It will cover a surgery called a paniculectomy, which is kind of like a mini tummy tuck, and that all it does is cut the skin off that's hanging and close. No muscle repair, no belly button move, none of that stuff should be covered by that. Pregnancy after tummy tuck, will the muscle separate again, or it depends? It depends. If the surgeon uses a permanent suture, the muscles kind of can't separate. If it was a dissolvable suture, then they can. But a lot of times, if your skin doesn't get damaged, you can restore your tummy tuck by wearing compression right after you have the baby. And if you've never had a baby before and never had a tummy tuck before, after you have the baby, put on a surgical compression garment, and it will close the hole up for most people, not everybody. The J plasma seems like pretty neat technology. I actually have the rep coming in to talk to me about it next week because I'm kind of intrigued by that, but I haven't done that myself yet. I won't say I don't do BBLs. I do them rarely, and I don't do the caricature kind. I do natural looking stuff, so my patients don't look manufactured. So I don't do that super small waist, big hips thing because I don't like it. Tanya, how painful is the recovery for lipo 1 to 10? That is a great question. and it really varies from person to person. I'll have some people who come in like, I'm fine. I don't feel nothing. Like, it's just, and then other people will be super beat up. And they might tell you their pain is a 7, and one person might tell you their pain is a 2. It's different for different people. What I will tell you is that it's not like a stabbing pain or anything. It's more like a soreness, like after a workout, but it's intense for some. So it doesn't stop people from going about their life. But it's kind of like when you do a really hardcore workout, how you feel it all through the day, but it doesn't stop you from... Who is that?
Me, I had to get something for my rose.
Okay, go ahead. I'm looking, I'm like, who is this person behind me? It won't stop you from doing the things that you have to do, but you definitely feel that you had surgery. What are some of the conditions that would prevent you from having surgery? Diabetes or hypertension? Okay, diabetes, I'm a lot more cautious with than hypertension. If your blood pressure is under control, hypertension is not a contraindication. Diabetes, that one is a little, like, I'm very reluctant to do surgery on a person with diabetes. It's not a complete deal breaker. I have done cosmetic procedures on people with diabetes before, but it's not often. Like, your diabetes has to be in almost perfect control, and your hemoglobin A1C's got to be good, and depending on what you get, you have to be prepared to pay to stay in the hospital overnight. And even if you don't take insulin, a lot of times the aftermath of having surgery will require you to be on insulin for up to a month after surgery to keep your blood sugars under control, because diabetes and hyperglycemia affects wound healing and affects your ability to heal the stuff. I don't take Care Credit. I take Alpheon, United Medical Credit, and Lending USA. They're all on my website. You don't have to be awake for lipo in my office. Most people are awake, but it's a choice. And if a person wants to be put to sleep, we go to Northside Hospital, and you're put to sleep. You just have additional costs to pay for OR and anesthesia. The aftercare is not really different. It's just depending on what surgery you get will kind of determine how long you have to stay. But for like a tummy tuck, you have to stay in town for 2 weeks. You'll be put on blood thinner and stuff like that to try to prevent blood clots from forming. Liposuction, I will usually let people leave after about 5 days. Oh, I talk about BMI. BMI stands for Body Mass Index. And they have BMI calculators on Google that are free. And you can type your height and weight in and it'll tell you your BMI. Hi, Morgan. Hello. Sharice. Yes, that sounds like good advice. Smart lipo, air sculpture. These, I haven't heard of air sculpture. I've heard of the water lipo. All these different ways, all these different things are just, I haven't done any liposuction, any type of liposuction that I think is better than traditional liposuction. The only thing that I find super useful is power assisted liposuction, which I do, but that's really still like traditional liposuction. Nothing is heating the fat or melting the fat or any of that stuff. It's not necessary. All those other things do is cause more scarring. So I used to do smart lipo and then I stopped because it caused more scarring. There's more risk with it. Regular lipo is the best one to me. I like that one the best. You get a you get less scarring with it, and it's simpler, and it works. And a lot of these other things are just kind of marketing ploys and ways to make it cost more money. That doesn't give you much improvement from traditional liposuction. Yeah, my stomach went down good with Myla Rose because I was in a compression garment right after I had her. I did the same thing with my boys. If the suture popped without from your abdominal repair, is there a way to fix it besides another surgery? Unfortunately not. You can't suture something without the tissue being open and exposed to see it and suture it. You got to get back in there. Sometimes liposuction can fix a dog ear, but a lot of times you have to cut the person. Talk to your doctor about the timing of staging procedures, Sherelle. Thanks, Sharon. He said, yes, it's $150. No, it's not free. Thank you. Thank you, Germany. Happy Wednesday, Lori. Can't wait to meet you, Laverdin. Tommy. Usually with my tummy tucks, I use the natural crease that your body has there, like the natural crease where the skin would naturally fold, and that usually is right at the top of the hair bearing area, and then it's like it's a crease there. People have a natural crease there. I usually put it there, and then it ends up landing underneath your underwear or bikini or whatever. Yeah, my mom looks young because I take care of her face. I'm helping her preserve her pretty. I lost 157 pounds. My skin hangs, but I think I need muscle repair. I can push my muscle and my fingers can go between the two muscles. I think that's what I'm feeling. Yeah, you definitely need a muscle repair if that's what you're feeling. That is, having a DVT is kind of an issue. I'm not saying the answer would be uniformly no, but it probably would end up at a no. You would have to get your hematologist's blessing before I considered it. Because I just don't think surgery is worth dying for, and DVTs are scary. DVTs, if those clots break off from your legs, it can go up to your lungs and kill you. It's just not worth it. So the way we would end up making that safe to keep you from forming DVTs is blood thinners, but then that makes you have increased risk for bleeding complications like hematomas and stuff. And so it's kind of like a fine line we're walking on. Hey, Jay, my husband's watching, everybody. He's being quiet on here and just watching. Thank you, Lori. Love you too, sweetie. Yay, Jennifer. Hi, Jennifer. Both of my girls on here. Yes, necrosis is tissue death. That's dead tissue. So, that is from lack of blood supply. And so lack of blood supply comes from a person who doesn't understand the anatomy or a person who's disrespecting the anatomy in a cosmetic procedure on a healthy patient. Now, if you have diabetes, that's different. That's not, that doesn't have to be necessarily something the person did wrong, because other than the fact that they operate on you with diabetes if it wasn't under good control. But in a healthy person with no real medical problems, in a cosmetic procedure, is an issue of not understanding the blood supply or ignoring your understanding of the blood supply. Is it too late in session for the skin lightening for hyperpigmentation issues? It's so hard to treat during the summer months. I'm using glutathione IV. You need to use sunscreen too. People, you should wear sunscreen every single day, even when it's raining, even when it's cloudy. And if you have a fresh surgical wound, or a scratch or some sort of cut, then you need to put sunscreen on top of that. Otherwise, it'll get really dark and sometimes it won't ever lighten up. When it's vulnerable like that from tissue injury, whether it be controlled injury or, an accident, it's so much more vulnerable to the sun and causes hyperpigmentation. You could probably get a consultation next week. I have time blocked out just for consultations. Honestly, so PEs, I've had that happen in 2 of my clients, and they were both tummy tucks. And the DVTs I've had 3 people get DVTs, and they were all tummy tucks, which is why I give blood thinner to my tummy tuck patients. Tummy tucks, part of the reason why they have a higher rate of DVT is because when those muscles are tightened and your organs, the main blood vessel coming back from your legs and going back up, delivering the blood back up to your heart, lives in your abdominal cavity. And when we tighten those muscles, it's a lot more pressure inside of your abdominal cavity. So it's like having the same amount of, say you have a jar of mayonnaise that's full, or a jar of pickles, or a jar of anything, and it's full, and then you get a smaller jar and you have to put all of that stuff in there. Stuff's going to be smushing out. It's going to be tight. If you try to pass something through it, you probably won't be able to. So when the blood's trying to return and it's going back up through that tighter container, it causes blood to kind of build up in your legs, and when blood sits, it clots. So that's why I routinely give my tummy tuck patients heparin to thin their blood, so that it's harder for them to make a clot. So the faja burn, people are going to get mad at me about this one. Okay, so when a faja burns you, it wouldn't have happened if you didn't have an issue with blood supply in the first place. So the faja burn thing typically happens in people who got aggressive liposuction and the skin was half dead anyway. And it's like if you're having an asthma attack, so you're gasping for air, and somebody comes and puts their hand around your neck and chokes you off while you already can barely breathe, what's going to happen? You're going to die. So the faja is like choking the asthmatic who's actively having an asthma attack. So if they weren't having an asthma attack, maybe they could have survived it. That's not even a fair analogy, because, well, it kind of is. If the skin and fat are barely alive and you go and choke it, it's going to for sure die. So I'm located in Johns Creek, Georgia. Liposuction leaves little teeny tiny scars. They're really small. I sure do have a website. It's www.ederrabella. I'll type it in again. EDERRABELLA.com. Well, don't they have to put more fluid back in the lipo? Show us what you mean when you say central area when you do lipo, please. Okay. I don't know what you mean when you say don't they have to put fluid back in. Okay. I will not, if I'm doing a tummy tuck, so if I'm cutting all of this stuff out, and when a tummy tuck, I separate the skin and fat from the muscles all the way up to the chest bone. So all of this gets lifted up. These blood vessels that are normally living here gets cut. I would not do liposuction in any of this. I won't do it on this part. Central abdomen. I will do it on the sides, or we can do it on the back, or if it's some other body part that's not connected to your central abdomen where you want liposuction, I'll do that. But I won't do liposuction here at the same time as a tummy tuck. Financing can be done through my office with Alpheon, United Medical Credit, and Lending USA. And I have links to those places on my website. You can apply for financing there. My favorite one is Alpheon. It's Alphaeon. The risk for loose skin depends on the quality of your skin, so I can't really say that. Like, it's not the same for everybody. Payment plans, kind of. You can call my office to get details about that. Yes, you can have a tummy tuck after a paniculectomy. It's the same way people get tummy tucks after a tummy tuck. It's no different. I do breast reductions. It's just like a breast lift. It's just more tissue coming out. Good for you and your insurance covering your muscle repair and new belly button. Usually what happens is they say no, or some surgeons will do a tummy tuck when they got paid for a paniculectomy, but I won't do that. They take way longer. It's way more work. I'm not doing a paniculectomy. I'm not doing a tummy tuck if you pay for it, or if the insurance pay me. Well, I don't take insurance, but when I did take insurance, I still didn't do a tummy tuck if you pay for a paniculectomy. It's way more work. It's two different operations. So, and then sometimes insurance companies will say before the surgery that they'll cover it, and then they'll come back and say, we changed our minds, and then they'll take the money back from the surgeon, and they don't end up getting paid, but you still have a tummy tuck, which is why I don't do that, because they're not supposed to be covered. It's not a necessity. It's cosmetic. Insurance companies do this thing called, what is it called? I forgot the word that they use for it, but they'll like go and audit all the charts, all of the stuff that the doctor submitted like for the year prior, and then they'll be like, oh, we changed our mind, we don't cover this, we don't cover this, we don't cover that, and then they will send the doctor a bill for the difference, and that's how you end up getting a tummy tuck covered, and the doctor gets screwed. So some doctors haven't gotten hip to that yet, and then they end up looking crazy later. Not me. Tummy tucks are cosmetic. It should not be covered by insurance. The tummy tucks, who would you need? The one that goes up and down and just regular tummy tucks? Does that make sense? The people who need the one where you have an up and down incision and the incision going across are people, usually it's people who have lost a lot of weight, and they will have excess skin in this dimension and this dimension. So if you've got excess skin this way too, then we need to pull it toward the middle. So that's the one, that's the time where you would need that incision. That's the thing, Nicole. It's not a medical necessity. So I'm not going to lie and say that it is when it's not. It's cosmetic. You don't need... Having a rectus diastasis does not hurt you. It's not a medical necessity. So it's fraud. If somebody's saying that you need a rectus diastasis repair, they're lying and they're being unethical. It's not supposed to be covered by insurance. So if people want that, you got to find the lying doctor who's telling the insurance company that it's a medical necessity for your diastasis to be repaired, because it's not. It's just ugly. It's not going to hurt you. Yes, I do laser treatments. Compression garments are very necessary after liposuction, and I have my patients wear them for at least 3 months. Thanks, Tommy. Exparel, that's it's fine. Like some people use it. I don't use it. But a lot of people do use it, and I have nothing against it. It helps with pain control. Usually I have people microneedle their tummy tuck scars, but I have a CO2 laser that can help with scars, but it's not really, CO2 lasers is not the best to use for dark skin. So I usually don't offer that as a treatment for African Americans or people or ethnicities that have more pigment in their skin. A hernia is different than a rectus diastasis. A hernia is covered by insurance, but getting a hernia repaired, your insurance will pay for the hernia, but they still will not necessarily, they shouldn't be paying for the tummy tuck. That is complete. They're not the same thing. They're unrelated, and you can fix a hernia without giving the person a tummy tuck. For lipo, about 3 days. 2 days. Yeah, 48 hours. 2 to 3 days tops. Caitlin, that's kind of the same question somebody asked me about DVTs. And it's highly unlikely that I would. I guess it depends on what you want. And my communication with your hematologist, but it's highly unlikely that I would be willing to risk your life to do any cosmetic procedure when you've had a pulmonary embolism. I recommend compression garments for 3 months at least. People who keloid, I would be hesitant to do a tummy tuck on a person who keloids. I wouldn't really want to do that. Because if you keloid, that's not really anything I can do to stop it. And then I would be like, dang, I made this big keloid on. Like, if I know a complication is going to happen, I'm not going to do it. Yeah, keloiding, when I have one patient that her tummy tuck scar tried to keloid. And when she would start itching like crazy on that scar, she would come in, she would rush in, and she was from out of town, and she would drive up because it was driving distance. And I would inject that scar with steroid, and then it would calm down. And we've been kind of doing that for like a year, and she hasn't made a full-fledged keloid. BMI requirements for tummy tuck in my office is 35 and 33 for liposuction. That's right, Cynthia. So she said, since you perform my Lipo 360, everyone in Baltimore keeps asking me if I had a BBL. My reply is no, Lipo 360 by Dr. Myla in Georgia. I keep telling y'all, when your waist goes down and your back goes down and your stomach gets flat, your butt looks bigger. And did we do gluteal contouring, Cynthia? You just got the Lipo 360 and your butt looks bigger. Michelle, to know if you need a Mons lift, you probably just want to talk to the doctors you consult with about their opinion on that. I can't really, kind of got to see it. April, go back and watch the replay. The first part of the video, I talk about visceral fat. Go back and watch the replay. Your question is very thoroughly answered at the beginning of this video. I wore my Leonisa garment. It was like a post-surgical, like a post-liposuction garment that I squeezed myself into. The first few days I wore an abdominal binder, and then once I got out of the hospital, I was putting on a compression garment. A compression garment is not as critical for a tummy tuck. It's the liposuction where you really need a garment. Like with a tummy tuck, you will be swollen, but the swelling actually, for most people, unless you have really insane amount of swelling, will go down. Just do what the doctor told you to do. Do what your doctor told you to do. Because that doctor know what they did, and they know if it's if they were so aggressive that they're not comfortable with you wearing a garment. Because you see how people keep talking about faja burns. If the doctor's telling you don't put the garment on, you should listen to what they're saying. Because don't watch my video and be like, well, Dr. Myla said I need to wear a garment. Dr. Myla didn't see you. Dr. Myla didn't do your surgery. Dr. Myla doesn't know what you have going on. And if you put the garment on and your blood supply is weakened, it can make your tissues die. So do what your doctor said. Swelling, April, is what causes that. Compression will make it go away. If you have severe loose skin, you might need it surgically cut away. What type of procedure would you recommend for a woman facial skin resurfacing for a woman between 50 and 60? If it's a white lady, I might say CO2 laser. If it's not a white lady, then I will probably have you do something like microneedling or a combination of radio frequency and microneedling. It just depends, honey. If your hematologist said no, Sean, then the answer is no. Like, don't tempt fate. Like, if your hematologist said no, that means that it's not safe. Like, no cosmetic procedure is worth dying over. The answer is no. Don't shop for some fool to tell you yes, and then next thing you know, you got a PE and a saddle embolus and you're dead. It's not worth it. If your hematologist said no, the answer is no. No. Your family will thank you later. Yes, Lord, you know I love taking care of faces. Right, Cody. It's like, oh, Mia, what's wrong with Myla? Hold on, y'all, my baby crying. She all right? Mia, is she all right? Okay. Oh, the air is in her room. Go on. Yeah, pull it. It's behind the door. Sorry, y'all. My sister's in town. Bennett, beat it. Sorry about that. So, Cody, you said you had a PE and was in the hospital for 4 days and almost died. Yes, PEs are serious. See, the DVTs are not what kill you. It's when the DVT breaks and goes up to your lungs and causes a PE that kills you. So when we freak out over a DVT, it's not the clot itself. It's please clot don't break off and go to this person's lung and kill them. When you hear people say, like the person had surgery and stood up and then dropped dead, that's a PE breaking. I mean, that's a DVT breaking off and going straight to their lungs. And when it's really big, it's called a saddle embolus, and it will kill you like instantly. That's what we're afraid of. Not so much the DVT, but the DVT breaking and going up to your lungs and causing major problems. It's not worth it. Like, I'd rather just have a big belly and be here for my kids and my family than, tempt fate. Sunscreen for dark skin? Abso-freaking-lutely. Okay, so this is one of those things that this is a myth that because you have dark skin, you don't need to wear sunscreen. It's so false. You cannot wear sunscreen if you choose, but no, you may not get skin cancer, but if you are interested in keeping your skin looking healthy and even and young, then you need to wear sunscreen, because everything that you don't like about your skin as you get older is caused 9 times out of 10 by the sun. So African Americans and Indians from India and, other ethnicities with dark skin, melanin does have like about an SPF 11 or so kind of effect on your skin. But SPF 11 isn't enough. So what happens when you're neglecting your skin by not wearing sunscreen and walking out in the sun every day for your whole life, and those UV rays are beating down on your skin, your body, it upregulates your production of melanin to make more of your own natural sunscreen. except it doesn't do it evenly. And that's why as you get older, black people get darker as they get older. Well, the ones who neglect their skin do get darker and darker, and they get dark patches. Like forehead might be really dark, their cheeks might be really dark, but in other areas might be lighter. It's not even and pretty. Is like uneven and not pretty when it's like that. So, and that's because your body's trying to make its own sunscreen because you won't put none on your face. Put the sunscreen on your face. It also, not just from a pigment standpoint. Yes, B-Pop.
I'm scared to stay upstairs.
How you scared to stay upstairs, Auntie Mia up there? You want to say hi to Facebook?
Hi, Facebook. My name is Bradley, and I'm wearing my pajamas.
Are you wearing your pajamas?
Yeah.
All right. Tell them bye.
Bye.
All right. Going upstairs with Auntie Mia. Or you can sit on the couch right there. You just got to be quiet.
Okay, I'll be quiet.
So, what was I talking about? Sunscreen. What was I saying? Oh, it does more than affect the pigmentation of your skin. It also, when the UV rays come down and hit your skin, it produces this stuff called free radicals underneath the surface of your skin. And free radicals basically run through your dermis and tear up everything. It's like rioters. Free radicals are like rioters. Just run around breaking up stuff, tearing up your collagen, tearing up your elastin, kicking your pigment producing cells. So some of them, they'll be like, and then they'll start making more pigment. And some of them will stop making pigment because they're beat up by the free radicals. So you get all this uneven stuff. But when it's breaking up your collagen and elastin and tearing that stuff up, it makes your skin saggier. So people be running around saying black don't crack, black don't crack. Well, it may not crack, but it does still sags and stains when it's neglected. And that's from lack of sunscreen. And people are always telling me, your skin is so even, it's so even. That's because I wear sunscreen every single day. Every single day. If I go to take my kids to the zoo, I'm reapplying sunscreen like every hour and a half to 2 hours. Folks be like, you got some white stuff running down your face. I'm like, oh, that's my sunscreen. I'll wipe that old stuff off and put some new stuff over it. Like, I am cuckoo about protecting my skin from the sun. If you are dark, there's nothing wrong with that. Dark skin is beautiful, but no skin that's 4 different colors is beautiful, in my opinion. It's supposed to be one color. It should be one even smooth color, and it should be tight. So, yes, Eric Kennedy, sunscreen for dark skin. I recommend SPF 30 or higher. Thank you, Trish. Tummy tuck BMI requirement is 35. The little knot in lipo incisions usually is scar, or maybe it might be a stitch if the person closed the liposuction hose. I don't know why they picked above your navel. Doing any type of surgery on a diabetic is risky, whether it's above or below your navel. I wonder if that was a plastic surgeon. Probably wasn't. It could be that you need liposuction or something like that, Daisha. I don't really run specials. The only time I have exclusive offerings usually is at my events. When I have events, I always have specials, if you will, at my events. And maybe once a year I'll have some special. I don't do specials very often. Exactly, Corey. Insurance fraud. People always trying to get some slick way to get somebody to do so. First of all, I personally, and y'all have heard me go on my rants about people paying me and stuff like that, because I just work too hard to do this for free. But I'm personally not interested in doing a tummy tuck for paniculectomy price. Insurance company will pay you $1,000 for a paniculectomy, and then I'm going to sit there and do 3 hours worth of work for a surgery that I charge $7,000 for. Why would I what's the incentive for me to do that? Doesn't make any sense. And I'm lying. So I'm committing a crime insurance fraud to give you a surgery you didn't pay for. Not doing it. Carolyn, I don't quote over Facebook. You got to give my office a call, sweetie. 678-325-0006. This is getting kind of long, y'all. I'm about to sign off. My doctor recommended Retin-A to light my scar. Would you recommend this? Retin-A doesn't necessarily lighten, but just do whatever your doctor told you to do. I'm not sure what your scar looks like, so it's hard for me to say yay or nay about that. I'm not sure the best way to do it, because honestly, when people come to my office to try to sell stuff, like, they have to give the information to my staff first, and then I decide if I feel like taking a meeting with them or not, because my time is valuable. So you might want to do that. I don't know. That's kind of a tough question, because I definitely guard my time from people trying to get me to sell stuff or use their stuff, because people come in doctors' offices all the time trying to like push their thing, and it's not impossible, because some of those folks I'm like, yes, I want a meeting with them, and some of them I'm like, no. So, but they never talk to me without me having a clue what they want to talk about first, and if I'm not interested, they don't get to talk to me because I'm just too busy. So that's kind of a hard question, Michelle. I don't have an answer for you with that one. Yes, I do arm lifts. Yes, I use ab boards. That's right, Cody. It's not worth your life. I wore a compression garment with a cesarean. I sure did. And I didn't wear one as tight as the ones I wore with my boys, because I didn't have C-sections with them. And so it was a lot more uncomfortable with the cesarean. So I wouldn't wear it. I couldn't tolerate it for that first couple weeks. I couldn't tolerate it all day. And that's when my little flap of skin formed, because I could see it forming, but it was too painful for me to wear it constantly when at the beginning. So it went down, the little flap went down a lot, but it didn't go all the way down because it got way too stretched out before I was able to tolerate wearing the garment all day. BBLs are not the only option to shape your butt. I do something called gluteal contouring, and I have a video about gluteal contouring if you scroll back through my videos. Yes, microneedling on the hairline helps restore, regenerate hair growth. I don't do total body consults. That's a good question, Michelle. Okay, this is my last question that I'm going to answer, then I'm going to sign off. So she said, when you do consults, do you do a total body consult for all areas of the body, make recommendations, or just what the patient asks for? Bennett, go.
Okay.
I just do what the patient asks. So sometimes people will try, what do you think I need, doc? And I'm never going to say anything. I'm not going to sit there and pick somebody's body apart based on my opinion. I only want to help you with what bothers you. And then because people value the opinion of their plastic surgeon, if they're coming into the office for something like that, I can give you a complex about something that you never even noticed. So I will never just go down somebody's body head to toe and be like, you need this surgery, you need that surgery, you need this. I will never do that. I would never break a woman down like that, because who am I to judge? Like, only what bothers you is what I care about. Now, the one exception to that rule for me is with skin. So when I do a consultation, I'm going to always see what bothers the person so that I make sure without a doubt I knock that thing out of the park. And then I'm taking a mental note of the things on their skin that bothers me, but they'll never know what I'm looking at and that bothers me. But the regimen that I put together will fix both things, your issues and the ones I have with your skin. You're not going to be mad that your skin is glowing and beautiful. That's not a surgery, though. And I didn't tell you, so you're not going to be freaking out about it, because if it's not bothering you right now, I'm not going to point it out so that you can start staring at it and then now you're bothered by it. Like, I'm not going to do that. So that's the only exception to that. That's a great question. Okay, y'all, it's been a while. I'm going to go ahead on and get off. If you want to reach out to me, you can reach me via my website at www.ederrabella.com, or you can call my office at 678-325-0006. Go ahead on, y'all, and watch the game. I'm going to go check out LeBron. He better win tonight. I'll talk to y'all in a few days. Bye.